Yeah, I'm Dr. Vanessa Grubbs. I'm a board certified internist and nephrologist, kidney specialist. I'm also the founder and president of black.village.org I messed that up. We're actually live though, huh?
That's okay.
I'm sorry. So I'm the founder and president of Black.Village, and the website is black.village.org. I'm also a published author, Hundreds of Interlaced Fingers, A Kidney Doctor Search for the Perfect Match that came out in 2017, but it's still available on Amazon.
Okay. So can you tell us a little bit about your journey to this point? How did you become?
Yeah. So I am originally from North Carolina, baby of 6, small town. I'm the first college graduate in my family. I'm the first physician in my family. And I envisioned myself being kind of a small town doctor, but then life happened. I ended up in California. And soon after I finished my residency at Highland Hospital, which is safety net hospital in Oakland County Hospital, I met my husband, who at the time had been on dialysis for some 5 years. And honestly, it was through him that I started to really understand what life is like for people dealing with kidney failure. And honestly, that was embarrassing because there I was, a doctor taking care of patients in the hospital with kidney failure. But I think that's one of the terrible things about medical training. It's all about the numbers and getting the orders, and you're so sleep deprived and the diseases, and you don't really get down to the person that's living with all of this. So because of our relationship, I got a much closer look into what that life was like, as well as the kidney transplant system. And I went with him to an appointment when he was nearing the top of the list, and it just felt like one of the most racist systems I'd ever seen. And I already knew there were disparities in by race and who has access to kidney transplant. But as I sat there in the appointment with him, I'm like, y'all don't see why there are disparities in this? I mean, look how y'all do this. And honestly, it was that day that I decided I wanted to try to be his donor. And I did. And so that was 18 years ago, April 15th, 14th, something like that. So 2005, we had surgery. And really, the whole experience made me want to figure out, well, what can I do for everybody else? I could give him a kidney and take him out of that system. But so I thought I can do research to figure out how to eliminate these race disparities. And honestly, I was just looking for a project, and I talked to a nephrologist. So it's kind of like, be careful who you talk to. And he said, you should become a nephrologist. It's just one tough clinical year, and it'll change the way you see nephrology and how people will perceive your work. And I was like, oh, okay, all right, I'll do it. And he was right. It was a very, very tough clinical year. And it definitely changed my perspective of how I saw medicine in general and nephrology specifically, in particular, because once I got into nephrology, I could see so many issues going on, particularly around the way we talk about dialysis, the way we didn't deal with end of life, even though we would lose 25% of our dialysis patients every year. They die. I mean, it's a very serious illness. And I really saw that we had like this, one size fits all approach when it didn't fit at all. Like, if kidney failure, then dialysis. Doesn't matter if you are 50 and that's the only thing that you're really dealing with, versus 90 and you have, close to end stage dementia and have to be tied down to get through it. And all of this just felt just so awful for me. And so I eventually got into my research interest became more about palliative care, which is about having extra support for a person. People tend to associate it with hospice, and there are different things. And that hospice is, someone is not accepting any kind of treatment, but palliative care you can have throughout the course of a serious illness. But because all of this was so strong for me, I decided to write a book. And so that's where the book came from. And so it does tell the story about myself and my husband, Robert Phillips, and who has not required any dialysis at all after surgery, after we left the hospital. He had a rough go of it in the hospital, but he's been able to live his best life since then. Whereas when he was on dialysis, he didn't really want to make plans because he didn't know if he was going to be around. So it's serious. And I mean, let's see, he was diagnosed with his kidney disease when he was 16 years old, and he was on dialysis at 26. That's a lot for a young man to have to really face their mortality like that. And so I wrote the book, and I was going along in my career, and then one day I joined the faculty. I did my training at University of California, San Francisco for nephrology, and I stayed on as faculty for a decade. And in that 10th year, I tweeted something that was too identifiable, and I was calling out the issue of how trainees and students can treat senior white men faculty very differently than they do junior women and of color faculty. It's a very real thing, but they were very upset with me for making that tweet. And I didn't know it was a problem for 2 months. And in that 2 months, they were, and by they, leadership of nephrology, leadership of medicine, the dean of academic affairs. I mean, they went all to the highest of high in the institution before I knew it was a problem. And then they told me I was wrong because I had misconstrued the situation, because the people involved, the trainee involved, wasn't white. And I'm like, you really think white people got a monopoly on anti-Blackness? That's not the way it works. So they told me I was bullying, and the whole element about how there's implicit bias. And I was just like, no, they didn't want to deal with that one because the trainees must feel safe. And I was like, well, how about me? Can I feel safe? And no. At the time, I was already planning to mostly leave the university to focus on my writing. I'm working on my second book. But because of that experience, I just felt like, I don't want anything else to do with y'all. I'm leaving completely. And the real final straw was they told me that if I had planned, I mean, it was moot at that point, but if I had planned to stay, that I would need to sign disclosure saying that I would never, ever be on social media about the trainees again. And I was just like, you're not going to take my voice, you're not going to take my voice. And honestly, once I left, it was a very painful experience, just because even though it was on my terms, I still carried a lot of just shame and hurt about the situation. And there's a lot to the story, a lot more, but really once I left and started getting involved more in a young group of Black doctors on Twitter through DM. And I'll just say that I was the only Black female on nephrology faculty in its 50 years of existence. And there was one in this first year and one that came right behind me, men. So that's it, 50 years of nephrology at UCSF. And I looked to social media for community, but they didn't understand that didn't matter. But the community that I eventually found, I learned that my story, what I had gone through, was really nothing compared to what so many are going through every day, and so much worse. I mean, honestly, we all have a story. It's just varying degrees of trauma. And the ones I feel, and it's at every level, medical students, trainees, practicing physicians, all of us. And then I learned that only 5% of residents in training are Black, but account for 20% of dismissals, meaning they got fired. And really supporting one young woman up close and personally with a small group of other Black physicians. She was being mistreated so badly. It was just awful. And I will say too that her story really isn't that different from what it accounts for a lot of this 20% of dismissals, because they do call it a lack of professionalism. And so this young lady, she was in a one party consent for recording. So she had all of these tapes and things. She had all of the evaluations. She had everything. And so we reviewed all of this. And I kid you not, the most serious thing they had for what she actually did wrong was an occasional noun-verb disagreement in her clinical notes. I'm serious. And this young lady was fluent in 4 languages: French, Haitian, French, English, and Spanish. So I think you get a little typo pass every once in a while. And for a lot of young people, these young residents, it's about not getting your clinical notes signed on time, and sure, these things are not 100% right, but it happens to everybody. So it's the inequity of it. Like the non-Black residents, particularly the white residents, aren't being pushed out for the same reasons. So all of that made me feel like, you guys, we really got to get organized. We got to start really doing something about this and make it stop. And so that was what motivated me to found Black Doc Village. We are a 501c3. And initially I started with the plan to support individuals, but very quickly, within a year, we're just a little bit over a year old, I came to a realization that it's not good enough to just catch our young people when they fall off the cliff. We have to figure out what is happening, prevent it from happening. And when I think about my particular set of skills in terms of writing, in terms of research, that's when we pivoted to our group being more about an awareness campaign, letting people know. Most people have no idea what's happening, and doing the research so that we can leverage that into policy change. So I founded the organization a little over a year ago. Where you chugging along. The Black Dot Village is, I'm a lot of the village, but I see this as my legacy work, and I'm not letting it go.
Wow. So what can what can students do who are going through medical school? What can they do to sort of maneuver past some of these pitfalls? And then part 2 of that question is, what can just the everyday patient, the everyday person do to support what you're doing and support, folks going through medical school?
Mm-hmm. So honestly, I know that medical students and resident physicians, they are aware of the problems, and they're very much like fight the power kind of attitude. And I get it. And at the same time, my advice is we need y'all to get through. So I know you want to, do all of these other things. You want to be engaging in all kinds of things because you see what our communities need. But we need you to be the best you can possibly be, learn the most medicine that you can possibly learn. And when, not if, when something that's not quite right happens, reach out to us early. One of the problems that we're seeing now, particularly my sister organization, the National Council of Residents, they provide that intensive direct support. They have several teams of Black physician volunteers to help these young people. Many of them contact them way too late. They contact them right before they're about to go into some disciplinary hearing. And there's really no way to kind of salvage that situation. So that would be my response for medical students. Focus, learn as much as you possibly can, and reach out to us often and early. So many don't recognize when they're in trouble. In terms of the day-to-day person, I was recently in Galveston, Texas for the Juneteenth festival, and I had up a whole tent and everything. And the way I was luring people to the tent, I had a sign that says, "Want a Black doctor, but can't find one? Ask us why." And the why is the system is pushing us out. So what I tell people that you can do if you're having a hard time finding a Black doctor, for example, you have insurance and there's no Black doctors in on your plan, then you can be active and reach out to the insurance plans. Like, why are there no Black doctors? We need Black doctors, because we know for sure, I mean, it's so many published studies that Black patients want Black doctors. More than half say it's hard or very hard to find a Black doctor, and that Black people get better health outcomes when they have a Black doctor. We know this over and over again. And all of this is happening. I like to help people understand that, okay, are we supposed to have so much sympathy for doctors? Boo-hoo, they're, whatever. But yes, it's a terrible thing for their careers to be derailed. But at the end of the day, it is about our community, because we have overall worse health outcomes than any other group. And if you prevent one Black doctor from getting through, you are preventing everything that they could have done to help their community have better health.
Wow.
Yeah.
That's an important way to look at it. So you mentioned earlier about your husband and the kidney. Can you briefly talk about your real kidney talks? What is that about?
Yeah. So when I left the nephrology faculty, pandemic happened, and I really did want to spend most of my time writing. So I didn't want a full-time nephrology job. So right now I'm doing a bit of primary care, and in a Black-led, Black-focused community clinic called West Oakland Health, but we're undergoing rebranding and resurging. We started out of the Black Panther movement. And actually, my husband is the CEO and president of the clinic right now. He didn't pull me over when, it's like, I know this man's heart. When he says that he has this vision for how we can take care of the Black community of the Bay Area, and that's what we're striving for, I know that's for real. Some people in leadership positions, they're just sitting there taking up space. So I wanted to be a part of that. But I do kind of miss nephrology, even though I didn't go into it for the reasons pretty much all of my colleagues go into it for. Like, they really get like geeked out over, electrolyte imbalances and acid-base disturbances and all that kind of thing. And then, that's cool. But I was there for, how do we help our people get the care that they need? So I started my YouTube channel, Real Kidney Talk with the People's Nephrologist, in part because one of the things I always really didn't like about healthcare, like in the clinic and the hospital, is that people had to come to us to get any education. And with kidney disease, people don't really have any symptoms at all until it's almost too late, until there's really nothing left to do but start dialysis, or you might not be with us much longer, right? So, and people are afraid. Nobody wants anything to do with dialysis, right? I think about it in terms of when people get cancer diagnosis, they lean in and say, okay, doc, what do we do? What do we do next? But when they have kidney failure, they lean back like, I don't want anything to do with that, right? And which is tough in a lot of ways, because kidney failure is more deadly than most cancers, right? And people don't understand this. So this YouTube channel is my way of bringing the education to the people in a way that I'm hoping they can hear it and feel that, they can trust what I'm saying. And I say it in a very, plain way, just like I wrote my book. The book, it was very important to me that the regular person walking down the street would understand everything and not be bored to tears. The kidney, right? That it wasn't hard. I had to work. So, and the best compliment I've gotten about that, about my book, was that it reads like a novel. To me, that was a beautiful thing. So, but then really the whole people's nephrologist thing came from on social media, particularly Twitter. My handle is the nephrologist. And I picked that because somebody else already had the kidney doctor, right? And so I thought, well, people gonna learn today what a nephrologist is. They're gonna learn today. And then a friend of mine whose mother was on dialysis, her daughter, the friend's sister, wanted to donate to their mother, and the mother said, no, I don't want to do that. But because she had some psychiatric history going on, they rejected her for getting a deceased donor, like a kidney from someone who had already passed. So, and it just, she asked that I sit down and talk with her mom and maybe try to help them navigate through the system of getting a deceased donor. And really, I sat down with them, and I kid you not, within 15 minutes of just giving basic information about what her kidney function meant, what the true risk of being a kidney donor was, and the risk of her going on to kidney failure. Of course, the mom, she had built up in her head all kinds of like worst possible scenarios, because that's what we do, that's what fear is. And me giving her just some basic information, factual information, she said, nobody ever explained it like that to me before. I'll do it. And the following year, they had surgery. Yeah. And on social media, my friend started calling me. I mean, of course, she was very thankful. And she said, you're not just a nephrologist, you're the people's nephrologist. And I'm like, okay, all right, I'm gonna lean into that one. And so that's when I started the YouTube channel. I don't do it as often as I would like. I post a video about once a month, and I try to be as interactive as I can with folks who are in the comments. And but I do enjoy it. It's a labor of love, because I really do feel like it's there's so much warranted distrust. I mean, the medical system has earned the distrust, but I think what it ends up doing is it ends up hurting us, particularly our community. So for me, it's important to get people information that they can trust and that they can believe, so that they can make proper decisions for their own health and for their family.
Well, that's good, Doc. Well, hey, you heard it here first from the people's nephrologist.
Yes.
Also, CEO of Black Doc Village, where you can find blackdocvillage.org. Thank you so much for joining us and just sharing your heart and sharing like who you are.
Thank you.
It's a beautiful story. So thank you so much. You heard it here first at the NMA Convention 2023.
All right.